Today I'm going to demonstrate how to do a peg tube feeding. The first thing you'll want to do is check your physician's orders. You'll want to wash your hands. You'll want to identify your patient by 2 markers. You'll want to provide privacy, and then you'll want to explain the procedure to the client as well. It's a good idea to have all your supplies gathered before you go into the room. You'll need your syringe, you'll need your feeding, you'll need your water and some measurements, gloves, and it's also a good idea to use a towel as well, just to prevent any getting the linen soiled. The next thing that you'll want to do is assess for bowel sounds. So you can don your gloves. When you assess for bowel sounds, you'll want to assess in all 4 quadrants, and you'll also want to put the stethoscope to the skin of the client. Okay. Okay, I do hear active bowel sounds. So now what I'll do is check for placement. When you check for placement, you'll draw up, I'm going to draw up about 10 cc's of air. You can draw up 10 to 30 cc's of air. And then I'm going to attach it to the client's peg. Now I'm going to clamp this off because I don't want any extra air to come into the site. And then you can hold that there, and then now I'm going to attach, put my stethoscope in and push the air in and listen for a swooshing sound, and I did hear that. At this point, we need to check for any residual that the client may have. So aspirate until you don't have any more residual, and actually this client does have some residual that's coming. It's going to be important to measure this. So clamp it off, disconnect it. I'm just going to hold this here for just a moment because I need to measure it in our container over here. Sometimes it's best to use a smaller container. So I will chart that my client has we can say that that is probably about 25 cc's of residual. It's going to be important now to put that back into the client. So in order to do that, we're going to just put it back in to gravity. You see I still have my tube clamped because I don't want any extra air going in there. I will pour the stomach contents back in. And then at this point, I'm going to flush with 50 cc's before feeding. And so I'll go ahead and get that prepared as well. Okay, so I'm going to let the stomach contents go back into gravity. And right before the stomach contents gets to the end, I'm going to clamp it off again because we don't want any extra air. So everything's ready for us to do our feeding. So I'll take the 50 cc's of flush before the feeding. And since my order says to flush with 50 before the feeding and 50 after the feeding, that's exactly what I'll use. The Jevity that I'm going to use, the doctor says to use 100 cc's. So we'll pour that up. Thank you.
Has a cap on it. Let's see.
If it does have a cap, we'll just break the seal and and then we'll pour up 100 cc's of our feeding. Thank you. You can see that that's 100 cc's. Now we will slowly pour this, and we're giving this a bolus to gravity because our feeding is not on a pump. And so we may not be able to, depending on the size of our syringe, we'll just let this go in slowly, and we'll catch it before sometimes it is kind of slow. Okay, it's just really slow. This is actually thick, so it's just going to take a minute or two. Okay, just to speed things up on the video, yeah, are you just showing me now? Okay. All right, so we've got the feeding, it's gone through, and now we'll need to flush with 50 cc, well, yeah, you will put the rest of your 100 cc's in here and let it go. Since this is quite thick with the equipment I'm using, I'm just gonna speed up our video because I want you to get just the process of it. So next, the doctor says to flush with 50 cc's after the feeding. So now we'll flush the rest. Okay, and that's going kind of slow as well. So you can kind of see it going to gravity, and just you want to make sure you catch it real quick before a lot of air gets in there. Whoop, got it. All right, so we've had 50 cc's of water before, 100 cc's of our feeding, and 50 cc's of our flush. At this point, we can recap our PEG. We'll also want our patient to stay elevated the head of the bed for anywhere from 30 to 60 minutes after the feeding to help with digestion. The position your client, I'd like to remind you that the position your client needs to be in is a Fowler's position. So you want them sitting up a little bit more than this. If that's contraindicated, you can turn them slightly over to a right side lying. Let's see. Got it? If it's contraindicated, you can turn them over, like I said, to a right side lying. And then at this point, we will chart everything. We'll need to wash our hands. We'll dispose of any biohazards that we have. Make sure the bed is in the lowest position, and make sure the call light is within reach. And make sure your side rails are up as well before you leave your patient.